Are there side effects that are reoccurring with these GLP-1s? And what do you recommend people do for, like, I know fatigue, nausea, what else? You hear a lot about not being able to sleep, maybe not necessarily related to sleep apnea, but just being up, going to the restroom, if nothing else.
Totally.
So what
Yeah.
do you,
So
what do you
the main side effects that we have with the GLP-1 based medications are nausea, heartburn, sometimes constipation or diarrhea, depending on the individual. Most of those are generally short-lived and they will go away as your body gets used to the medication. And that's why we start at super low, work our way up. But for some people, they don't. And so it's just ensuring that it's like at a manageable level for them. Like if you have a little bit of nausea and it's not like quality of life and you're not like, oh God, I just don't even want to exist in the world and that sort, then it's again finding that balance, so ensuring that you're getting the best quality of life and actually towards health versus feeling like garbage all the time in the name of weight loss. So that's kind of the first and foremost, assessing what is the side effect that's coming up, how bad is it, and that sort of thing, and is it going to go away, is it sticking around, and so on. In general, when it comes to managing it, like from a dietary and just lifestyle perspective, it's pretty simple things for especially nausea, heartburn, and that sort. Is trying to just eat smaller, more frequent meals throughout the day. If you, prior to the medication, only had foods that triggered heartburn or caused nausea or anything like that, then yeah, the GLP-1 medication is going to enhance that effect. So trying to avoid those foods, spicy foods, coffee, those sorts of things are already probably going to be a trigger for most people. So just being mindful of it. One big thing that I see people doing is they'll eat and what have you, and then they'll go and lay flat or semi-flat. What happens there is that you're basically allowing the food and the stomach acid to kind of come up into the esophagus, and that's really going to create some issues and inflame the esophagus, further worsening that heartburn. At least when you eat a meal, you want to be standing upright or staying upright for at least an hour. Definitely don't eat and then go right to bed, or if you do, try and at least prop yourself up to kind of it and manage it. So that's kind of the lifestyle perspective of things. The next big thing would just be kind of over-the-counter type products, things for, I'm a big fan of Gaviscon, kind of creates kind of like the floating wrap as they show in the commercials and stuff, but that can really help any acid that's coming up and helping it to get neutralized. If we need something that's a little bit more kick, then we look at the proton pump inhibitors like Pantaloc or Nexium and that sort of thing to kind of more in the short term.